Revenue cycle terminology, letters A through D. Flashcard terminology followed by definition. Glossary of terms from NAHAM and AHAM. Abuse. Incidents or practices that, although not usually considered fraudulent, are inconsistent with accepted sound medical, business, or fiscal practices, directly or indirectly resulting in unnecessary costs or improper reimbursement for services that fail to meet professionally recognized standards of care, or that are medically unnecessary. Accreditation. Defined as a self-assessment or external peer assessment process used by healthcare organizations to accurately assess their level of performance in relation to established standards and to implement ways to continuously improve. Accreditation is a review process conducted by an independent third party that an organization participates in to show their ability to meet or exceed established industry standards and regulatory requirements. In healthcare, accreditation reflects an organization's dedication to patient care, high standards, and an extraordinary patient experience. There are several accrediting bodies in healthcare, including the Joint Commission, TJC, Healthcare Facilities Accreditation Program, HFAP, and DNVGL. Accrual Method. Method of accounting in which income is recognized at the time it is earned, even if not yet collected, and expenses are booked as they are incurred, even if not yet paid. Acute care. Medical attention given to patients with conditions of sudden onset that demands urgent attention or care of limited duration when the patient's health and wellness would deteriorate without treatment. The care is generally short-term rather than long-term or chronic care. Acute inpatient care. A level of health care delivered to patients experiencing acute illness or trauma. Acute care is generally short-term, less than 30 days. Advance Beneficiary Notice, ABN. Written notice issued to a fee-for-service original Medicare beneficiary before furnishing items or services that are usually covered by Medicare but are not expected to be paid in a specific instance for certain reasons, such as lack of medical necessity. ADA, Americans with Disabilities Act. Americans with Disabilities Act, a law passed in 1990 that requires employers to make reasonable adjustments to the work site to accommodate a disabled person's ability to perform the job and requires buildings to be accessible to those with disabilities. ADC, Average Daily Census. Average daily census, the total number of patient days in a given time period divided by the number of days in that period. Advance Directive Living Will. Also known as a medical directive, healthcare directive, or living will, a legal document in which a person has outlined what they would like to be done if they are no longer able to make decisions for themselves due to incapacity or illness. Ambulatory services, same-day surgery. Patient receives surgical treatment and is discharged from the facility within 4 to 6 hours of procedure. Ambulatory services can occur in an outpatient hospital department or in a freestanding ambulatory care facility. Ancillary services. Physician refers patients for scheduled and non-scheduled services such as radiology, laboratory, and/or other services that are performed in a hospital or clinic setting. Patient leaves the facility once the services are completed. Anti-kickback statute. Anti-fraud federal criminal statute that prohibits offering or exchange of anything of value in exchange for healthcare business referrals, including cash, rent, expensive hotel stays, etc. ALOS, average length of stay. Average length of stay, a metric calculated by dividing the total number of patient days by the number of days in that period. The average number of days of service rendered to each patient during a specific time period. Total patient days divided by the number of discharges. Formula. Total patient days for number of discharges divided by total discharged patients. Authorization requirement. Certain services need authorization while other procedures might not. Some insurance companies require a CPT code or ICD-10 codes. Balance sheet. A financial statement that shows a snapshot in time of the business. Batch processing. Execution of a series of jobs in a computer program without manual intervention. It is used to help maximize the use of computer resources and stabilize response time by performing system-intensive work during hours when users are less likely to require access. Unlike real-time transactions, jobs executed in batch are not available for users to view until after the batch is run. Carve-out. A decision to separately purchase a service, which is typically a part of an indemnity of an HMO plan. For example, an HMO may have a carve-out, the behavioral health benefits, and select a specialized vendor to supply these services on a standalone basis. Carve-outs may also include medical devices that the plan pays for in addition to the contracted per diem or case rate. Pre-certification/pre-authorization is often required for these benefits and services. Case management. Coordination of services to help meet a patient's healthcare needs. Centers for Medicare and Medicaid Services, CMS. Federal agency under the Department of Health and Human Services, HHS, that administers Medicare and partners with state governments for administration of Medicaid and other programs, including the Children's Health Insurance Program, CHIP. CHAA, VA. The Civilian Health and Medical Program for Veterans Administration is an insurance program for the families of veterans. CHAA VA is also secondary to Medicare. CHAA VA is secondary to other insurance plans except Medicaid. Charity care. Free or discounted medical care provided to patients who do not have the ability to pay for all or part of medical costs due to limited income or financial hardship. Coinsurance. The percentage amount that is payable per policy provisions toward medical costs after the deductible has been met. For the example, a patient's coinsurance amount may be 20% and the insurance company's coinsurance could be 80% under a contract. Condition Code 44. Sometimes a Medicare patient is admitted to a hospital as an inpatient, but upon internal review, the hospital determines the services did not meet inpatient criteria, and the admission is changed to observation. This rule has become informally known as Condition Code 44. Condition Code. A two-digit UB code that clarifies an event or condition related to the bill that may affect payer processing. Copayment. A payment that must be made by a covered person at the time of service. Services that require a copay and the predetermined amount payable for each service are specified in the policy. Copayments may be required for physician visits, prescriptions, or hospital services. Electronic Protected Health Information, EPHI. Any protected health information, PHI, as identified under HIPAA, that is produced, saved, received, or transferred in an electronic format. Deductible. The amount of eligible expenses a covered person must pay each year from his or her own pocket before the plan will begin to pay for eligible benefits. DNVGL accreditation. DNV Healthcare is an accreditation organization approved by CMS in 2008 that has accredited approximately 500 plus hospitals. Downtime. Time the computer system is unavailable to users. DEERS. Defense Enrollment Eligibility Reporting System, the system in which military dependents must be enrolled to receive benefits under TRICARE. DHS. Designated Health Service. DME. Durable medical equipment, any equipment that can withstand repeated use, is used for a medical purpose, is of generally no use in the absence of illness, and is intended for use in home. DME-POS. Durable medical equipment, prosthetics, orthotics, and supplies. DME-RC. Durable medical equipment, regional carrier, and a MAC to which the DME is billed. DNFB. Discharged, not final billed. An account for a patient who has completed treatment but has not had a claim produced. DNR. Do not resuscitate. A document that states that the person does not wish to have CPR or similar interventions performed in the event of a medical emergency. DOS. Date of service. DRG. Diagnostic Related Group, a group of services that has a payment weight assigned to it, based on the average resources used to treat Medicare patients in that DRG. Dual eligible. An individual who is entitled to Medicare Part A and or Part B and is also eligible for some form of Medicaid benefit. Durable power of attorney for healthcare. A document that designates someone else, known as a surrogate, agent, or healthcare proxy, to make decisions on the patient's behalf if he or she is unable to do so, also called a healthcare power of attorney.